This presentation will talk about the agonist drug, particularly the full agonist, the partial agonist, and the inverse agonist. So when we say agonist, this is a drug that mimics the endogenous receptor ligand to activate the receptor to produce a biological response. It has both affinity for the receptor and intrinsic activity to initiate the response. If the drug binds to the same recognition sites as an endogenous agonist, then it is called a primary agonist. So again, when we say endogenous agonist, now these are the substances that are produced within the body. So an example of this is acetylcholine. Now acetylcholine is considered to be an endogenous agonist of the cholinergic receptor, nicotinic receptor, and the muscarinic receptor. So aside from this, now aside from acetylcholine, the nicotine and muscarine are also specific agonists of one kind of the cholinergic receptor. So again, nicotine is an agonist of the nicotinic receptor and muscarine is the agonist of the muscarinic receptor. So acetylcholine, on the other hand, is an agonist of both the nicotinic and the muscarinic receptors. So again, in this figure, in this diagram, you can see that the nicotine has a positive effect to that of the nicotinic receptor, meaning that it will produce it will activate the receptor, and the value of its efficacy is positive, meaning that it will enhance the biological response of this receptor. The same is true for acetylcholine. So you have here a positive sign for the muscarinic receptor, and muscarine, it has also a positive effect to that of the muscarinic receptor. So nicotine competitively binds to nicotinic cholinergic receptors in this image. The same is true for the muscarine agonist. One type of an agonist is the full agonist. When we say full agonist, and these are compounds that can elicit a maximal response following receptor occupation and activation. It produces a maximal response by occupying all or fraction of the receptors. It has a maximal positive intrinsic activity or efficacy. Numerically, we can describe the efficacy of a full agonist as equal to 1. This diagram shows the dose response curve of 4 agonist drugs or 4 full agonist drugs. The x-axis represents the drug concentration in logarithm scale, and the y-axis represents the response. So as you can see here, as we are going to increase the dose of the drug, there is also an increase in the biological response of that particular drug. So increasing, for example, the dose of the drug will reach the EC50, and further increasing the dose will reach the maximum efficacy or the Emax. So these are examples of full agonists. So we have drug 1, 2, 3, and 4. And as you can see, all of these drugs are full agonists because they were able to produce a maximum response. In terms of their, of course, potency, they differ in potency because the dose required to produce EC50 varies for these 4 drugs. An example of a full agonist drug is heroin. Heroin is a full agonist because it is able to achieve maximum effect at a particular dose, and this is achieved by binding and activating the mu receptor. So this is the effect, clinical effects of heroin, and this is achieved by binding to the mu receptor. So the endorphin is considered to be the endogenous ligand of the mu receptor. In the brain, naturally produced opioids, which are called endorphins, are released in the synapse and activate the opioid receptors, producing a classic mu opioid response. So the mu receptor is an example of an opioid receptor. So when endorphin will bind to the mu receptor, what will happen is it will produce responses or the effects in the body such as analgesia, euphoria, constipation, and respiratory depression. When exogenous opioids like heroin are ingested and enter the brain, it will also act and activate the mu receptors, producing the same results. Because heroin is considered to be a full mu opioid agonist at some dose, the receptors are fully activated to a theoretical 100% maximal effect. Another example of an agonist drug is a partial agonist. These are compounds that can activate the receptors but are unable to elicit the maximal response of the receptor. It has a lower positive intrinsic activity relative to that of the full agonist. It may also competitively inhibit full agonist, preventing maximal biological response. So if the partial agonist is bound to the receptor, the full agonist cannot bind to that receptor. This is a dose response curve of a full agonist, now that is in red, and a partial agonist in blue. The x-axis represents the drug concentration in increasing dose, and the y-axis represents the response in percent of the maximal. So as you can see here, now when we are going to increase the concentration of the drug, a partial agonist and the full agonist, you can see also here that there is a gradual increase in the biological response of the drug. In the case of a full agonist, it was able to achieve 100% efficacy, because it is a full agonist. In the case of a partial agonist, so a partial agonist can never achieve the maximal response that the system is capable of because its efficacy is lower than that of a full agonist. In short, the maximal efficacy of this drug is lower than the maximal efficacy of a drug which is a full agonist. This diagram is a concentration response curve of four drugs A, B, C, and D. Again, the x-axis represents the concentration of the drug, so from left to right, that is increasing dose in logarithm, and for the y-axis represents the effect of this particular drug. So in the curve or in the diagram, you can also see the EC50. So again, the EC50 is a helpful parameter in order for us to determine the potency of the drug. So as you can see here, you can see that in terms of the potency, the drug A is considered to be the most potent of all the drugs because it was able to achieve EC50 at a lower dose. In terms of its efficacy, of course, the A and B have the same efficacy, and the letter C have a lower efficacy compared to A and B. Now, because again, these A and B, so we can say that this drug A and B are full agonist because they were able to achieve maximum effect. The drug C, because no matter how increasing the dose of this particular drug, we were not able to achieve maximum effect, so this is considered to be a partial agonist. So they have a positive efficacy, meaning that they are all agonist. The letter D is considered to be an agonist because it has no efficacy, and no matter how we increase the dose, there is no efficacy that is observed. This is a concentration response curve of what happens when we are going to administer a full agonist with a partial agonist. So if a partial agonist drug is used at the same time as the full agonist and they both act on the same receptors, what will happen is the partial agonist will compete with the full agonist for the limited number or the finite number of binding sites. So in this diagram, so you can see that when we are going to administer a full agonist in the presence of a partial agonist, what will happen is the efficacy of this particular drug is the same. provided that we increase the drug concentration, particularly the concentration of the full agonist. So to be able to, for example, displace the partial agonist from binding to the receptor, to the same receptor, we need to increase the dose of the drug, the full agonist, in order to achieve the same maximal efficacy. So therefore, when we are going to administer them both, the potency is reduced, but the efficacy would still be achieved. It shows the occupancy response relationship of 5 different drugs, drug A, B, C, D, and E. From this graph, now we can determine the drug's efficacy or intrinsic activity represented by IA and their receptor reserve. So again, the x-axis represents the occupancy rate and the y-axis represents the effect in percent. So when we say occupancy, that is the maximum number or percentage of receptors that have been occupied by the drug relative to achieving the maximum effect. For example, in this drug A, the drug was able to achieve its maximum effect, 100% effect at this particular occupancy rate. So this is about 25, probably 20% occupancy. So, and the same is true for drug B. It was able to achieve its 100% maximum efficacy or intrinsic activity at this particular occupancy rate, meaning that it occupied about 60% of its receptor in order to achieve this maximum effect. We can say when we are going to compare the intrinsic activity of this particular drugs A to E, we can say that the drug A, B, and C are considered to be full agonist, while the drug D and E are partial agonist. In terms of their receptor reserve, the drug A was able to achieve maximum efficacy at 20% occupation rate, meaning that the 80% of its receptors are still unoccupied, but it was already able to achieve 100% efficacy. So the drug A has 80% receptor reserve. For the drug B was able to achieve maximum efficacy at 60% occupancy rate, meaning that the remaining 40% of its receptor are unoccupied. So letter B, therefore, is considered to be a full agonist with 40% receptor reserve. The drug C was able to achieve maximum efficacy at 100% occupancy rate, so meaning that there is no receptor reserve. The drug D and E, on the other hand, so again, since they are considered to be partial agonists, they will not be able to achieve maximum efficacy. So the drug A and B, therefore, exhibit the concept of the spare receptor. Why do we use a partial agonist? We use partial agonists because the full agonist may cause too much activation of the receptor, resulting in toxicity or receptor adaptation of prolonged use, as exemplified by desensitization. So again, when we say desensitization, that is a phenomenon wherein the body does not respond to the drug anymore. We also have the downregulation, so that is of course as a result of the prolonged activation of the receptors, so the body tends to decrease the number of receptors in the body or in a particular organ or tissue. So because the partial agonists have a lower efficacy, so these drugs minimize the complications or the adverse effect from the administration of these particular drugs. An example of a partial agonist is buprenorphine. Buprenorphine is an opioid drug. It is a partial example of a partial agonist. So just like the heroin, it activates the mu opioid receptors, producing the same results: analgesia, euphoria, constipation, and respiratory depression. But it does so to a certain limit because it is a partial agonist, so it will not be able to achieve maximum effect. So the effect of the buprenorphine has a certain limit, and that limit is known as the ceiling effect. So because even if we increase the dose of buprenorphine, these effects do not go above our theoretical ceiling limit. If we were to say 50%, no matter how much buprenorphine we provide or we give to the patient, the level of analgesia, euphoria, or respiratory depression will not go above these limits. Another type of an agonist drug are the inverse agonists. When we say inverse agonist, it produces opposite biological response to that of the endogenous agonist or neurotransmitter. It has a negative intrinsic activity or efficacy. So the efficacy of this particular drug is less than 0%, i.e. negative 10% of negative 20%. So what is the requirement for a drug to be called as an inverse agonist? A prerequisite for an inverse agonist response is that the receptor must have a constitutive activity in the absence of any ligand. What do we mean by constitutive activity? So this refers to the ability of the receptor in producing its biological response in the absence of a bound ligand. So constitutive activity means that the ligand or the receptor rather still has the ability to produce its response even if the ligand is not bound to that particular receptor. So the constitutive activity of the receptor may be blocked by an inverse agonist. This diagram shows a dose-response curves of a full agonist, a partial agonist, a neutral antagonist, and an inverse agonist. So the x-axis represents the dose of the drug in increasing concentration from left to right, and the y-axis represents the efficacy or the response. So we have here a zero effect, and from that, from uh, below that we have the negative efficacy, and above that is the positive efficacy. So we have here a requirement for the inverse agonism is the presence of the constitutive activity of the receptor, meaning that kahit walang ligand that is present in the biophase, so the receptor still will produce some response for its or innate response. So in this figure, in terms of the efficacy, the efficacy of a full agonist is 100%. The partial agonist is below that of the full agonist, so it will not be able to reach 50%. Of course, for the antagonist is zero; it has zero efficacy, and an inverse agonist, so it has less than 0% efficacy, so it has a negative efficacy. So dito siya, negative yung kanyang efficacy. Or it will inverse the constitutive activity of the receptor. We also have here the another comparison, dose response curve of a full agonist versus a partial agonist. So again, when we say inverse agonist, so its biological response is opposite to that of the agonist. So it will, for example, it will bind to the receptor, blocking the agonist, and at the same time, it will activate the receptor and induce a negative efficacy. So for example, when the biological response of that particular receptor is to increase the heart rate, when the inverse agonist will bind to that particular receptor, what will happen is the opposite will be the effect. So there will be a decrease now in the heart rate because it produces the opposite biological response from that of the agonist. So again, in terms of the efficacy, so meron siyang negative efficacy.